Thermoregulation is the ability to balance heat production and heat loss in order to maintain body temperature within a certain normal range. For a newborn, the normal body temperature ranges from 97.5 to 99.3 degrees Fahrenheit. Maintaining a neutral thermal environment is one of the many challenges that a newborn must face after delivery. Thermal care is seen in reducing morbidity and mortality in newborns.
One more push, Sherry. Yay!
Aw, wait, why does my baby have to be skin to skin?
It's to prevent heat loss from the baby so it doesn't have hypothermia.
Hypothermia can occur when the newborn's temperature drops below 97.5 degrees Fahrenheit. Most cooling of the newborn occurs immediately after birth. The infant's temperature may drop 0.5 to 1.7 degrees Fahrenheit per minute if not kept at warmth. Certain individual characteristics put newborns at a greater risk for heat loss. This includes premature newborns, a large surface area to body mass ratio, decreased subcutaneous fat, greater body water content, immature skin leading to increased evaporative water and heat losses, poorly developed metabolic mechanism for responding to thermal stress, and altered skin blood flow. There are 4 ways in which a newborn loses heat. The first source of heat loss is evaporation. This is the air drying of the skin that results in cooling. Evaporation can occur during birth, bathing for moisture on the skin or wet hair, wet linens, clothes, or diaper, and from insensible water loss such as sweating. Drying the infant, especially the head, as quickly as possible helps to prevent heat loss.
Hi Sherry, how's it going?
Oh, great. The baby just had a bath and now he's just resting.
Can I take a quick look at him? I want to make sure he's fully dry.
Fully dry? Why does that matter?
Well, if he's wet, then the water is keeping him warm. But as soon as the water evaporates, he may become cold and lose some of that heat. So we also want to make sure that he's dry after bathing, especially the head. Now let's check his temperature too. His temp's at 96.4, which is a little low. Let's get some dry towels and warm blankets for both of you. This will help raise his body temperature.
Oh, okay, thank you.
You're welcome. It's also important to postpone any bathing periods. Bathing newborns too soon after birth can cause a drop in their body temperature, which was the cause here. Once we assess him and when his vital signs are stable, we will determine if he's ready for a bath.
I had no idea that could happen. I just wanted him to be all clean.
That's all right, Sherry. Now let's just get him all warmed up.
The second source of heat loss is conduction. This is the movement of heat away from the body which occurs when the newborn is placed on a surface or directly touched with objects that are cooler than their skin. Cooler objects include a scale, circumcision restraint boards, cold hands, or a stethoscope. The reverse is also true. Contact with warm objects increase body heat. Warming objects that will come in contact with the newborn or place an unclothed newborn on mother's skin helps prevent heat loss. Hi Sherry, how are you doing today? How's the little cute guy doing?
I'm doing okay, but I guess he's very restless and he won't stop crying. It's a little overwhelming.
How long has he been in the onesie?
A while, I guess. I lost track of time because he's so fussy. He won't eat. I checked his diaper and it's clean, and I don't know what's wrong with him.
Let me take his temperature. 97.1. Alright, Sherry, his temperature is below normal, which answers why he's been so fussy. Babies do not have the shivering mechanism that we do, so crying and being restless is their way their body produces heat. I would like to undress him and put him directly onto your skin. This will warm his body temperature and help with the fussiness.
Oh, okay, thank you. I had no idea. I just really love this onesie that I got him and I put him in it.
Let's undress him. And we'll keep a blanket over him as well.
Thank you.
You are welcome.
The third source of heat loss is convection. This is the transfer of heat from the infant to cooler surrounding air. Convection can occur when drafts come from open doors, air conditioning, and even currents created by people walking around. When newborns are in incubators, the circulating warm air keeps them warm, providing a draft-free environment.
Hi Sherry, how's it going this morning?
Oh, fine. It's a little cold in this room. I asked my sister to turn up the heat on the thermostat a few times, but it didn't seem to do anything. I think it might be broken.
I can have maintenance look at that right away, but we may need to move you and your baby to a different room if it is broken.
Oh man, I have all my stuff in this room. It'd be a hassle to move it all. Are you sure we can't just use some more blankets?
Unfortunately, that won't work. You and your baby have to be in a room that is at least 77 degrees Fahrenheit to prevent the baby from losing any heat. Let's check and see what his temperature is at.
Okay.
His temperature is 93.8 degrees, which is extremely low. We will need to move you both out of the room, and we are going to set him up in an incubator right away. The incubator will circulate warm air, which will warm his body temperature.
But I don't understand. He's all wrapped up in blankets. How did his temperature drop?
In this case, his temperature dropped due to the cold air that is circulating in the room. But we will get him in an incubator right away and get his body temperature up.
Thank you so much.
You're welcome.
The fourth and last source of heat loss is radiation. This is the transfer of heat to cooler objects that are not in direct contact with the infant. Placing cribs and incubators away from windows and outside walls minimizes heat loss.
Hi Sherry, how's it going in here?
Good. It looks like such a beautiful day outside, but my friend told me it's only 40 degrees. But I opened the curtains anyway to let some natural sunlight in.
It does look nice, but we may have to move up your baby a little farther away from the window. Let's check his temperature. His temperature is 97.2, which is a little low. Let's move him away from the window and close the blinds.
Wait, I guess I'm a little confused. The room is warm enough and the windows aren't even open, so they aren't letting any cold air in. Why does my baby have to be moved?
In this case, the radiating cold temperature outside can transfer to your baby since he's with close proximity to the window and alter his body temperature.
Oh, that makes sense. In that case, please close the blinds immediately.
Sure thing. Let's get a little hat for him and get him undressed and put your skin to skin to warm up. Okay. So pretty. All right. Okay.
Treating hypothermia in the newborn is important in order to avoid serious and potentially life-threatening complications. Increased cellular metabolism takes place as the newborn tries to stay warm, which can lead to an increased oxygen consumption, which puts the newborn at risk of hypoxia, cardiorespiratory complications, and acidosis. Newborns with hypothermia are also at risk for hypoglycemia, neurological complications, hyperbilirubin, clotting disorders, and even death if left untreated.
It is important to know the signs and symptoms of hypothermia in the instance that you may need to intervene. Signs and symptoms of hypothermia include acrocyanosis and cool or pale skin, hypoglycemia, bradycardia, tachypnea, respiratory distress, decreased activity, feeble cry and poor feeding, and decrease in weight gain.
The World Health Organization has come out with 10 steps of the warm chain to prevent hypothermia. These steps include a warm delivery room, immediate drying, skin-to-skin contact, breastfeeding, postpone weighing and bathing, appropriate clothing and blankets, keeping mother and newborn together, warm transportation, warm assessment, and training and raising awareness.
Depending on the severity of hypothermia, different intervention will be used. For mild hypothermia, skin-to-skin contact in a warm room, place cap on a newborn head, cover mother and newborn with warm blankets. For moderate hypothermia, under a radiant heater, in a warmed incubator, in a heated water-filled mattress. For severe hypothermia, using a warm incubator should be set at 1 to 1.5 degrees Celsius, higher than the body temperature, and should be adjusted as the newborn temperature increases.
Hyperthermia is defined as body temperature above 99.5 degrees Fahrenheit and is frequently a result of environmental factors that cause overheating. However, regardless of cause, hyperthermia can have severe consequences if not corrected. Some causes of hyperthermia include overheating from incubators, radiant warmers, or ambient environmental temperature, maternal fever, maternal epidural anesthesia, phototherapy lights, sunlight, excessive bundling or swaddling, infection, central nervous system disorders, or dehydration.
Signs and symptoms of hyperthermia include tachycardia, tachypnea and apnea, warm extremities and flushing, dehydration, lethargic and poor feeding, irritability, weak cry, hypotension, seizures, and hypernatremia.
The usual approach to treating a newborn who has hyperthermia is to adjust the surrounding environment. The newborn should be moved away from the source of heat, undressed partially or fully depending on severity. If the newborn is in an incubator, the air temperature should be lowered. It is important that the newborn be breastfed frequently to replace any fluids that may have been lost. If the newborn cannot breastfeed, extra fluid should be given intravenously or by tube. A warm bath can be given if hypothermia is severe. During the cooling process, the newborn's temperature should be monitored every 15 minutes.
Balancing heat loss and heat production is important in maintaining normal body temperature to prevent hypothermia and hyperthermia. Knowing the causes, signs and symptoms, and interventions of both medical emergencies is essential in planning, treating, and caring for the newborn.